Hello, thank you so much for having me here with you this afternoon. I'm excited to talk to you a little bit about COVID-19 vaccine hesitancy and how that may or may not have impacted routine vaccine hesitancy, including with the HPV vaccine. So for those of you who are not familiar with Vaccinate Your Family, we've been around for 30 years, co-founded by former First Lady of Arkansas, Betty Bumpers, and former First Lady Rosalind Carter. We work to protect people of all ages from vaccine-preventable diseases, from raising awareness to vaccines and the diseases they prevent, to making sure that we have policies in place that enable people to access vaccines. So in the spirit of today's theme, a little bit about myself. I made my own little baseball card here. So I'm Erica DeWald. I've spent 16 years working on vaccine issues, particularly around vaccine confidence and hesitancy. I am the Chief Communication Officer here at Vaccinate Your Family. My boss, of course, is Amy Pisani, who I'm sure many of you know from years past at this roundtable event. And my notable plays are, I've spent the last 16 years working with all of you to build a national framework for vaccine confidence. So let's get into it. Is it all hype? Is the COVID-19 vaccine hesitancy all hype? I'm going to compare it, to keep this baseball theme going, with the Bobby Bonilla effect. So for those of you who don't know who Bobby Bonilla is, he was one of the top players for the Pittsburgh Pirates back in the 1980s. The New York Mets were so impressed with him that they spent a massive amount of money. They still pay him to this day. That's how big his contract was. And he was totally overhyped. Right? He was past his prime at that point. So my question is, were we overhyping vaccine hesitancy in the COVID-19 pandemic? I would say yes. So I appreciate this may be a slightly difficult slide to read, but you don't need to see the exact numbers here. What you need to see are the trends. So Pew asked people prior to the release and the authorization of a COVID-19 vaccine, would you be willing to get a vaccine? And you see people started really high. That was while we were all in lockdown, while most people were stuck under stay-at-home orders, right? So everyone was desperate to get out. They wanted that vaccine. They wanted to be able to return to what their lives were, what their new normal was. And then you see that number dip. So as people were able to go back out into the world, as they were able to go back to their businesses and to grocery stores, et cetera, people were less excited for a vaccine. But what always drove me crazy about this was there was no vaccine to ask people about. It was such a hypothetical question of, would you get a vaccine that doesn't even exist yet? Of course, people didn't know how to answer that. So were people actually hesitant about the COVID-19 vaccine? I would say, let's look at the actual data. How many people are vaccinated against COVID-19? Now, I used in this slide the COVID fully vaccinated number from the CDC COVID tracker. So fully vaccinated means 2 doses, essentially, of Moderna or Pfizer, or of course, if you have some people who previously got the J&J vaccine when that was available. The numbers are pretty good. 67% of people have at least 2 doses of COVID-19 vaccine. That is one of the highest adult vaccination rates across the board. Now, if you look at children, right, so they also give you the numbers of population of over 5 years, over 12 years. If you pick those numbers out, I am concerned about the rate of vaccination among 5 to 11-year-olds and 12 to 17-year-olds. Although, again, if you look at that 60.4% and compare that to HPV vaccination rates in their first year, significantly above, right? So again, compare what we're looking at to other routine vaccinations when they were introduced. And you'll see we're pretty much on par. So much so, I went back and I looked at what were those original polio, measles vaccination campaigns numbers. So when you look at that, 2 years after the polio vaccine was introduced, only 50% of people were vaccinated. And I think this is important because if you look at it, you can just see this background photo, right? These were the lines of people waiting for the polio vaccine. When the COVID pandemic began, I used this picture on my background on my Zoom. And everyone said, wishful thinking, Erica, this will never happen. People won't be lined up. Look at the media images from early 2021. What do you see? People lined up to get this vaccine, right? So we've done it again. And if you look at the numbers, we're on par with the most famous, looked to, revered vaccination campaign of our times. So I think when we talk about COVID-19 vaccine hesitancy, we have to get past that hype, past the Bobby Bonilla effect, and really look at what's going on, how many people are choosing to get vaccinated. So I think COVID vaccine hesitancy is overrated. So my next baseball analogy for you is Moneyball. For those of you who are not Oakland A's fans, who didn't live this, who didn't read the story, didn't see the movie, it was all about the Oakland A's who didn't have enough money to buy the really big players, right? They're trying to build a baseball club without a lot of money. And so what Billy Beane did was he looked at different stats. It wasn't just the number of hits, the number of runs. It was about percentage on base, right? How can we go down a level deeper to find out what's really going on? So when we think about routine immunization rates and whether people are hesitant, we don't have the data, that prime data of high vaccination rates. We know they've dropped, but we don't know why. And I don't think it's a good idea to go ahead and say, well, it must be because of hesitancy. It must be because of COVID-19. We don't know. And as public health professionals, we really need to wait for the data, right, to understand what's happening. In the meantime, how can we figure out what are some of those pieces that help us understand where people are at, how COVID-19 vaccine hesitancy has affected routine immunizations? So this is a study from the Rockefeller Foundation at the end of the pandemic. And we all know it's still going on, right? But at the end of last year, how are people feeling about vaccines post-COVID-19? 50% of people are absolutely still 100% behind public health. Tell us what to do, we'll do it. Tell us to get vaccinated, we'll go get vaccinated. Tell us to wear a mask, we'll keep wearing a mask. 21% of people were what they call box checkers. So, okay, what do I have to do to get back to my life? Vaccinated, fine, I'll do that. Wear a mask, fine, I'll do that. I'm not enthusiastic about it. I'm not particularly concerned about whether this is preventing transmission, but I'm going to do it. This is the interesting one that we have to watch, the 14% who are self-defenders. The Rockefeller Foundation identified these people as individuals who are willing to do anything except get vaccinated. They would continue to wear their masks. They would get tested as often as you wanted them to get tested, but they would not get vaccinated. This is the 14% that we need to reach out to, that we need to figure out where's that disconnect happening, that you understand and believe in public health and will follow the rules, but you don't believe in and trust vaccines. That's the 14% that we have to look for. The 15% that won't do anything, right? That don't want to wear masks, don't want to get vaccinated. We've always had that group, right? It's always been 10 to 15% of people who don't believe in vaccines. So when you look at this number, 15%, this doesn't necessarily reflect a change, right? We've always had 10 to 15% of people who chose to never vaccinate. It's the same amount, right? I would argue the only percentage we have to look at is that 14% of self-defenders. And there's no evidence, because they talk to adults about adult vaccination, there's no evidence that this is going to leak into other routine immunizations such as HPV. So at the end of the day, we're headed to extra innings. We don't know what the data is. We have to wait for the data to understand whether COVID-19 hesitancy is affecting routine immunization. Please, 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 we all know this. Anecdote does not equal data, right? I've read a couple of stories here and there where somebody claims, oh, I talked to such and such pediatrician and they're seeing more hesitancy. That's one practice, one doctor. And we also know from our years of working on vaccines and autism, on HPV vaccine, that questions do not mean somebody is hesitant about vaccines. It means they have questions. We have a highly educated public now around vaccine science, vaccine development, vaccine safety procedures, right? We've created that during the COVID-19 pandemic in encouraging people to get the COVID-19 vaccine, which by and large they did, right? Those questions are now transferring to other vaccines, but it doesn't mean that people are hesitant. It just means that they're smarter consumers of vaccines. And finally, we all know this, HPV vaccination was always an uphill battle, right? We're not any worse off in HPV than we were beforehand. We're still facing the same challenges we always did. So regardless of COVID-19 vaccine hesitancy, we're still dealing with HPV vaccine hesitancy. I would urge you to keep an eye on monkeypox. and the monkeypox vaccination situation, because people are viewing that as a sexually transmitted disease, even though it is not a sexually transmitted disease. It just happens to be in a community in which it is being transmitted through the skin-to-skin contact during sex, but again, not sexually transmitted. But because this concept of sex has been introduced through monkeypox, and it is comparable to why people are hesitant about the HPV vaccine, I think seeing how people react to monkeypox, should it become a bigger issue, should it start spreading to more children, will be an interesting indicator of whether it changes people's view of the HPV vaccine. So thank you so much for your time. I really appreciate being here, and I look forward to your questions.